Wayne Butler is the secretary for the Shared Parenting Council, which really means he does pretty much all the work. No, but he's got a great team that help him. Ed Bosky sends his apologies today, can't be with us from Western Australia. But I don't believe Wayne needs any introduction, because the Shared Parenting Council has really been a prime mover for shared parenting, quite literally in Australia, and there's a lot of dads that are alive today because of what Wayne and his team have done. A big hand for Wayne. Thank you.
Well, look, thank you for that, and we're making progress. What an exciting place to be today. And Eric, you're an inspiration, I must say, and such enthusiasm. It rubs off on us. It gives us the impetus to go forward further. Yeah. I was here on March 19th, 2008, when we sat around a table very similar to talk about men's health. What are we going to do about men's health? How are we going to get that off the ground? And here we are again a year and a bit later, and fantastic progress has been made. We have on the table a draft policy. Now, at first, our news publications were annual health check and prostrate is man's lot. That was the original thought we had. It's a start. It's a great start, because we can expand on that with John's help and others in the room here. We can expand on that and move forward. The SPCA doesn't work specifically in men's health, but what it does, it works in the area of family law reform, child support legislation, child support reforms, local court proceedings, related legislation in state government, to effect, at the end of the day, shared parenting outcomes. And we want to see children have contact with both mum and dad. And that is part and parcel of the health philosophy, the big picture, which was discussed at length with many of the submissions. There were a number of submissions to the Senate that were very interesting. They dealt not specifically with just men's health, but not specifically with just cancers and other problems, and as John's pointed out on many occasions, on the big picture, the health holistic picture, the picture of the social determinants of men's health. And that's where we see a lot of people come to us, people who have been deprived of contact with their children, and in the early stages particularly are depressed enough to commit suicide. It was very interesting, and Eric, you mentioned the case recently of Nick on the New South Wales Central Coast. He was going to commit suicide. He had a 2-year-old son who he couldn't see. And what's that got to do with men's health, you say? But it is part of the big picture of men's health. Yeah. And so we shouldn't rest on simply dealing with the medical issues. We must continue to move forward to a holistic position, and I think we're in a really good position to start with something and to expand on that. Our view is that we're very keen to see a department of men, or a department of men's health, or some agency that's specifically funded and set up to deliver and drive forward the specific issues that we have on our plate. Just as a last thing, I might mention there were 1,880 suicides listed in the ABS figures for this 2007 period. 77% of them were male, Eric, so that's straight from the ABS. The last thing, this does require vision. This whole program requires a lot of vision, and in this room there are many visionaries. I'm really pleased to be associated, and our organisation is pleased to be associated. It requires great commitment to effect these changes, and I say to you, movers and shakers only need apply for this. Yes. Thank you.